We will be delivering 180 beds across British Columbia to support people in their journey to recovery.
The province is taking steps to tackle the toxic drug crisis by expanding treatment and recovery options. The Premier is sharing his vision that no person should have to wait for detox. When someone raises their hand and reaches out for help, it's there immediately. Nearly 100 of these beds are already open, transitioned from private beds at a cost to public. The remainder are expected to launch across the province this summer. So less than 100 new beds, but a switch from a largely private and costly system to public, free of charge. The announcement comes a day after the province set a grim record for toxic drug deaths, 2,511 in 2023.
The biggest impact is that there's that many more beds at no cost across the sector, so that people who have had the barrier of not being able to afford to access services, now that's reduced or that's eliminated for people.
Richard Thompson says he's an addict in recovery.
Yeah, I was living on the streets. I was living in a constant cycle of overdoses in the hospital. I was incarcerated because of drug addiction.
Thompson says he knew he needed help and put his hand up, benefiting from a bed at Discovery House, a nonprofit organization in Penticton. But he says the road to getting into a crowded system wasn't smooth.
When you're ready for help, when you have a moment of clarity, it's hard to get into places. There's wait lists, and you need to get into detox first, and there's wait lists for detox.
The beds, existing and new, will be spread out across the province, serving people in rural and remote areas with easier access than before.
And we've helped to ensure that the resources that are now open, people can refer themselves. They don't have to go through a lot of bureaucratic red tape to get into the service.
But will 180 beds be enough? Since 2017, the province has added just shy of 600 new treatment beds. The province is losing nearly 7 people each day to toxic drugs. Nearly 14,000 people have died in 8 years of the public health crisis. In Vancouver, Kate Walker, City News.